Another overflow?
Oh, yeah, we got another. I came up there with a big umbrella that morning, and I thought we missed this when we moved. But,
Oh, my.
You know what I found interesting is that what you said and how practice was in the early 70s. I mean, that's like modern time.
Yes, right.
It sounded like early 1900s.
Uh-huh.
Amazing.
Yeah, we weren't doing blood gases. The blood tests we did were very crude, and
He came in 73, right?
Right.
And Roy came in 76.
So no, he came 3 years, 80. He was here.
No, he had to come in 76 because I came in 77.
Right. Yeah, well, that's right. He's 77 to 79. Yeah, he was with me 77 to 79.
I remember calling him when I moved from Steubenville, and I called him because I went to school with him and his brother, and I asked him, "What do you think? I could start an ophthalmology practice here." And he said, "Can you start on Monday?" Yeah.
Oh, he was he was an Amish fellow, and we're setting up the office, and he just grabs this board and he cuts a beautiful scroll out of it, puts it right in there, and everything. And I said, "How'd you learn it?" He says, "Amish, we're Amish. We're born with a hammer." And a great administrator, because he got the medical building going. Farnham tried to do it, Mansell tried to do it, and you couldn't get 18 doctors to agree on anything. And he came up with the concept of building a medical building. The hospital would own the medical building, but the doctors would own their own offices. And that was unheard of at that time, that we could invest in ourselves instead. I remember going into the library, we had 18 doctors, they were all sitting there like that, and they weren't gonna give up. But he was able to take it and really run with it. He was a tremendous. So when he just told me, he says, you've got everything you need here. You have all the specialists. We haven't had a new doctor in Millersburg for 10 years. He says, I've got to go back there. I said, sure, that's great. And I'd cover for him, and you look out and all the horses were lined up in front of the office, and I had asked this woman, I said, well, you're 38 weeks pregnant now. You're starting to dilate. Can you come back and see Dr. Miller next week? And she looked at Emil, and yes, Emil says I can come back next week.
Did you get the calls? We used to get letters or postcards in the mail from the Amish down in Holmes County.
Oh, really?
Whatever it was, and they'd say, we're going to bring an Abe in for an eye examination on next Friday.
Yeah.
We'll be there in the afternoon sometime. And we always had scheduled that you'd come at such and such a time.
Right.
You couldn't call them back. You couldn't call them. You'd tell them you were there. You just said, okay, whatever it was, they'll be here. And
right.
Pull the buggy up.
Right. The buggies were parked outside of Ebner's office and your office. Yeah.
There we go. Yep.
Yeah, because I covered for him the weekend. He says, I've got 3 women that I promised I would deliver at home. Would you do that? And he said, well, let me tell you right now, there is no such thing as malpractice. If the mother dies and the baby dies, that's God's will. You've got an IV and you've got a foot pump for vacuum, and that's all you got. I said, yeah, there's no malpractice. This is great. I'll do it at home. Yeah. Bring out the hot water and newspapers. You bet.
What year was that?
79, 80. Mm-hmm.
Rick Rose is still doing the hand surgery in the kitchen on the table.
Oh, really? Is he?
Yeah, he's still doing it.
Oh.
He's still doing it.
Yeah, I had one. They called me a farmer cut his extensor tendon, and I said, well, we'll have to ship you down to the hand surgeon in Worcester. He said, oh, you can do that. I said, well, I've read about it, and I know the technique but I've never repaired a tendon. He's, oh, go ahead and do it, So I always ask, how's that farmer? He said, oh, he's fine. His fingers don't. So it was the other thing that Roy wanted. He could do anything down there. He was not limited. You didn't have everybody watching over your shoulder. No.
Doesn't matter what it is, they'll never see.
No. It's just a whole different way of thinking down there. It's just delightful people to work with.
I used to get all the kids for business. They come in with their eyes crossed like this because there's so much inbreeding.
Oh, yeah.
Down there that they end up with all kinds of diseases because of the inbreeding. And, good people. People.
Yeah, they are good, solid people. They paid in cash. Yeah. Because they had all this money. They were, farming, and they brought in all, so they didn't have to buy any food. They didn't have to pay for electricity. They didn't have to pay for cell phones. They didn't have to, and all they did was make quilts, and they would sell these quilts for thousands of dollars,
And they're beautiful.
Oh, they're absolutely gorgeous. So,
Now they have to buy their electric bikes.
yes,
Electric bikes, solar panels
yes.
on the barn, and cell phones that's charged by the solar panel, so that's okay.
Yeah, it's DC. It's not AC. That's okay.
Yeah.
Mhm.
Interesting. Interesting.
Yeah. Yeah, we saw the last of the golden age of medicine. You just did what was right.
Yeah.
Like I say, I had a 90-year-old that had a GI bleed, and at that time we didn't do colonoscopies. You did an upper GI and a lower GI because I didn't know where it was coming from. And I told utilization, I want to admit that. She says, "Why? Is he bleeding?" That I says, "No, but he's 90 years old. He has nobody to take care of him. He has no way to get prepped for it with enemas and everything else. So I want to put him in and get the." No, we can't do that unless he's actively bleeding. You're not allowed to admit him. I was like, "Jeez, if this was your grandfather, how would you like this?" It's just. But we did. We just did at those eras what was right for the patient. We didn't.
Yeah, before they did the colonoscopies, remember you used to use the sigmoidoscope?
Oh yes.
I still remember
Me.
you, and I'm on the table, pull my legs up, you got the proctoscope, and you stick the proctoscope in, and you said, "You know what? I bet you there's a lot of people in town that would love to have you in this position."
And he says, when we're done, will you tell Nancy you didn't find my head up there?
Oh my.
You're right. That's what we always did with sigmoidoscope. We didn't have colonoscope, so it's like doing a mammogram only on the right breast. We don't want to. Now with the colonoscope, they do the entire thing. So
I'm still amazed. I mean, it just seems like primitive medicine almost compared to today.
Mhm.
Yeah. Well, until what, 1920, something like that. If you were diagnosed with diabetes, that was a death sentence.
Oh yeah. Yeah.
And anything you couldn't do. You couldn't do a thing. Nobody had discovered the medications to control the insulin.
No.
And you just died.
Right. That was it. You've been on a strict diet, and but that prolonged things maybe a month or so.
Maybe a month or so. And that's as far as you'd ever get.
Right. And like I say, that's.
Get pneumonia. R.L. Mansell used to say the only thing I could do was sit to the bedside and hold their hand while they died.
Mm-hmm.
And that's not that long ago.
Yeah.
You're saying it. It's just like,
No.
I mean, we all remember.
Yeah, he was telling me about an older farmer out here that developed pneumonia with mustard plaster and everything on it, and then he took care of it, and then the wife contracted it, and they both died. Within a couple of days of each other. Nothing you could do about it. You just put mustard plasters on and held their hands, and that was it.
And what was the purpose of mustard plaster?
It draws out the infection.
My dad loved it.
Really? Yeah. Mustard plasters.
Yeah.
Mm-hmm.
We always had a stock at
Oh, Dr. Mansell just had quite a practice because we always were so honored with it. I couldn't call him Linn. I tried once to call him Linn, and I choked on it. Yes, no, Dr. And we would cover for him when he'd leave. And oh my gosh, all these people just crash when they go, "Oh my gosh, Mansell's not here."
Speaking of which, I just talked to them at the hospital earlier this week. And when it comes time to do our display, we have two, I think they were done by, you remember Elmer Zarni? Yeah, Elmer Zarni. He did the assemblages.
Oh.
So there's two assemblages with RLs. This one and this one, which is the front door of his office. They're about this big and about this deep.
Wow.
And we can have them in springtime.
Who has them today?
It's at the hospital. They're at the hospital.
Oh.
It was down here.
Oh.
And then I've got one from Elmer that did with like eye stuff too.
His work is great.
Oh, yeah, yeah. 3 of Elmer Zarni's, things that we'll be able to, but they're gonna get huge. We'll probably have to set them up on here because they're bolted to the wall of the hospital now, but they're gonna take them down when we, I told them we didn't need them till spring. So, those will be good.
Great.
What is Charlotte Carson's name now? Starts with a K or something? No.
Diver.
What is it?
Diver.
Diver, yeah.
Yeah.
Is she at Western Reserve?
Yes, well, that was her last address. I don't know if she was there because of
Has
their.
anybody talked to her about Andy?
We haven't yet, but she was on our list, I think, originally.
Okay.
She's still, she's an active member
Yeah,
here. And,
yeah.
I'm sure she'd probably sit down and chat.
I wonder if she has some stuff too, probably from Andy.
Yeah.
Probably does.
Because that's
Oh.
another story.
Andy and Irene and Dan Leskowitz, they ran this town. That was it. Mm-hmm.
But whatever you had, except for eyes, Andy Carson would do it.
Oh, yeah.
The hip done, Andy Carson would do it. You needed a whatever. he'd do
Yep.
it.
He was
Mm-hmm.
on the
Yeah.
sidelines of every football.
Oh, yeah.
game.
Yeah.
You know, all the sports physicals were done. And
Yeah.
He was, real, he took care of the county home residents.
Yeah, oh,
too,
yeah.
many years.
So I think we definitely need to find some stuff
I
for
can get in
her.
touch with her.
Yeah, he would be the only one that would come in the ER. And by the way, the morgue was right across from the ER. It's a little spot in the back there. Yeah.
And when I first came here, I wasn't sure I could tell the morgue from the ER.
Yeah.
In the basement, remember, of the hospital?
Uh-huh.
Oh,
Basement and in the back. Well,
Yeah.
Andy,
That's more.
Andy Carson, he had Roy parked in Andy's parking spot once.
Oh,
And
yeah.
Andy came in and says, I dug that spot out by myself with a shovel. That is my parking spot, and nobody is to park in that spot but me. So a week later, Roy Miller got a big plastic plaque and he glued it on with industrial glue. Private parking for Doctors Miller and Carson only. You can still see the little pieces where he took the screwdriver and had to peel that thing off. Oh, yeah. Yeah, we've had some interesting. My most interesting letter was from a patient, and when I retired, she says, you know, Dr. Robertson, you delivered me. You were the only doctor I ever knew growing up as a child. She says, you just delivered my baby. And I just assumed that when I was an old lady in the nursing home, you were going to be my doctor. So yeah.
I think that's the beauty of family practice, because Dr. Tuziak said those exact same things.
Mm-hmm.
Family practice.
Yeah, there's something about delivering a baby and watching that baby grow, and yeah, we were the only ones sent flowers for funerals for our patients, and they always say, is that admitting malpractice? No, I think they just did. I really love Mabel Gormans, and she was a sweet lady, and I like to send her flowers.
I think I still have a letter at home.
Oh yes.
That you wrote me. I'm gonna have to pull that out.
To Mabel Gormans,
Yep.
Had all kinds of horrible things wrong with her. Everything that ophthalmologist hates.
Yep. You referred.
Well, that's.
Was a non-existent patient.
Oh.
Well, they did to me when I graduated from the family practice center. The next day I was coming to Medina to open my practice. And they said, that's it. I said, it's my last patient. I'm done. They said, oh, Doctor, I'm really sorry, but one more patient called from Medina. They want to be your patient. And we worked them in. I said, oh, all right, okay. And I picked this chart up, and she's 375 pounds. Her blood pressure was like 300 over 120. Her urine showed 4+ sugar. Her chief complaint was, I am just so tired. I said, how could you do this to me? How can you do this to me?
First person in your practice.
Oh, no. I go in, I open the door. Hi, I'm Dr. And there's our director with a babushka on, up in stirrups. So I did that each year. So we picked out one of the senior residents, and we would do that. And I would sit there with a babushka on. Oh, they had a good sense of humor, everybody. Yeah, I forget what that It was Mabel Gormich. You're right. That was the name of this patient.
When we came here, everybody knew, all the other docs knew their wives, knew their family.
Well, even the lawyers. We had Dr. Lawyer.
Yeah, we had Dr. Lawyer golf out.
Yeah.
Remember? Not now.
Right.
Not now. We did other things, Dr. Lawyer. What else was it? We did the golf outing and something else.
Well, that Wedgwood, we'd have a dinner once a year,
Yeah,
at least,
yeah,
with
dinner.
all the lawyers and all the
Dr.
attorneys would get together.
Yeah.
Yeah, we even had one of the attorneys scrubbed in on surgery, and they nicked an artery, and it was a major bleed and everything, and they were able to control it. He says, he says, if I hadn't been there and seen what it was really like, he says, I would have been willing to sue on this case. He said, but knowing what it's really like in surgery and how difficult it is to know exactly what you're doing and how easy it is to nick an artery, he says, I just have an entirely different appreciation. And that was our relationship. Doctors and lawyers, we got along real well.
Some other not so good things. Remember the medical staff thing? We used to have ashtrays on all the tables.
Had what on the table?
Ashtrays.
Oh, yeah. Oh, sure.
Yeah,
Sure.
everybody was smoking.
Oh, sure.
You
Mm-hmm.
could smoke in the hospital.
Oh, yeah,
Nurses
sure you could.
station.
Yeah.
Does anyone remember the original hospital? Just that little house she came in, and surgery was on the right, and the administration was up those stairs. And mm-hmm.
In Hall.
Oh, yeah. He was a true gentleman. Yeah, there's so many stories I love to tell, but I just really think it's better to keep my mouth shut.
Remember when Ed Kuhn came in dead? The only way they could tell him was the thing he had around his neck. I mean, because he was in that. Ed Kuhn was an OB doc,
Mm-hmm.
and coming home and was a little 3 sheets to the wind,
Mm-hmm.
and came over the railroad track and went head on into a truck.
Oh,
Yeah.
Killed him, burned almost beyond recognition when they brought him in. Came there to work that morning and went through the ER.
Yeah. Mm-hmm. Well, wasn't Farnham in a bad accident too? And yeah, someone had to pull him out of the car. Someone else, doctor here. Mm-hmm. Yeah, there wasn't such thing as DUIs then. You just went home. You just drove home then.
Yeah. Pick them up, put them back in the car, and take them home, and don't do this again. I know that one.
Yeah. Well, I drove ambulance for Dunn and Quigley funeral home. Yeah, our motto was "You're never wiggly when you're done by Dunn and Quigley," and that's all you do. You picked them up, you put them in the ambulance, and you drove to the hospital. You never start an IV or ask them what was wrong. You just get them to the hospital. That was it. Yeah, now they're treating them on the way. They're transmitting EKGs. They're giving IV medications and everything on the way. So, can I say such changes I've seen in my short life.
On the ambulance, it used to be they would listen to the monitor radios and they would race to see who could get
see
there
which
first.
ambulance could get there
And then
first.
the second ones would be racing to the tow truck company.
Yeah.
Oh my.
We're going to have to talk to Ed. He said he just doesn't want it videoed. He just wants to talk.
Well, what? I mean, it doesn't make any difference. You don't even know that there's a camera there. You just, like, I talk to you most of the time. I found that's the easiest way is pick out somebody in the audience and talk to them.
Maybe once he sees that it's a relaxed atmosphere and it's not this big camera. And
Nancy said, well, why doesn't he want to do that? Well, you never know. I mean, maybe he was to the dermatologist and he's got half his face. So that's what I got to do tomorrow.
Yeah, well, I just had that, frozen off my lip. It's the same thing. Who's doing it?
Long.
Oh.
Long.
Yeah, I had a little brown spot there, and that's what this whole big flap is. They took the whole thing off. Yeah, there you go. Yeah, you can show them something really ugly. Yeah, but Farnham has really seen the stories too.
Yeah, he's 94 now.
Yeah, he just sold his airplane.
Yeah,
Mm-hmm.
just sold his airplane. It's
Mm-hmm.
flying up until last year. Yeah, it is.
Yeah, his story was, I admitted this patient with a bowel obstruction. He says, all you got to do is NG tube, put it at rest, it'll make it. He'll decompress and she'll do. I said, no, she won't. So we went through 2 days, and on the third day she wasn't any better. And he says, give her one more day and she'll recover from this thing. So he went to Wellington to operate, and I got hold of Chin. I said, Chin, come on in here. And we operated, and it was all straggly. It couldn't do it. So he came to my office and he wrote, I told you so, I told you so, I told you so. And he said, here, I'm going to hang that on the wall. I gave you 3 I told you so's. Yeah, he was my everything was just so simple that time. I had a fractured nose and I had the cast. I said, what do I do with this thing? And I would go down to his office, and he said, well, this is where you put it in and how you do it and everything. And I thought, oh, great. And then he'd come up, what the heck's this rash I got here? And everybody just took care of things.
So between doctors today, does that happen?
No, not so much. No. They asked me what in the past 55 years of working with residents, what's the biggest change that I've seen? I said, the new residents, I'm not able to pronounce her name. It's just, they just don't. I mean, it's nothing against them, but they want a job from 7 to 3:30 and be home with their children. They don't want to stay late. They don't want to work weekends. They don't want to work holidays. They've got their family to take care of. So it's more of a business.
How many gals did you have in your med school?
25 we had all in the office, staff.
No, in your medical school class.
5 out of the 150.
In the class.
Mhm.
I think we had 6.
Right.
Now it's like 60% women.
Right.
Oh, okay.
Right.
And nothing, I think they're great, but they take time off to have babies. They want to stay home. So you end up probably getting maybe 60% of a full practicing position out of that, because they're off for having kids, and raising kids and things like that. So out of the 150, now you're only getting really maybe 90 full.
Right.
And I don't know. I don't understand.
But they're great. I mean, do you know Glenna Jackson, my partner? Yeah. Because it was tradition when a new partner would join me, we would take vacation and then they would be solo for the first week, because we didn't want to hang over. Okay, do this. Okay, refer here. We didn't want to be telling them everything. So we took off when Glenna came, and I came back after vacation. I asked our nurse, I said, how was it last week? She said, oh, it was absolutely horrible. We had patients coming in here at 7:30. We had to send out for cheeseburgers for lunch. We had to go right through lunch. We didn't get out of here until 8 o'clock at night. This office was just jammed with people, Then I saw Glenn. I said, hey, Glenn, how was it? He said, well, I just say we'll never do that again. That's all she ever said.
What year did you have when was that you had your
2 or 3 years ago. Mm-hmm.
Oh, there's
Afterwards, she says, oh, I'm so glad you're 80 instead of 18. She says, I got so much skin to work with here. Yeah, she was great too.
Who did it?
It was down in Florida.
Oh, yeah. That's right.
Done down there. Yeah. Yeah, remember Dr. Carson had his little office right there where I think it's the women's rehab or something place now, right there on Washington Street, right by the cemetery, right at a corner from the church.
Is that an apartment building now, or what is that?
I thought it was for rescue for women, the abused women or something, that they can park in there. That's why the parking lot is all That's why the parking lot's enclosed. Yeah, you can't see whose car is in there, and they try to keep it that way. But
It used to be, I thought, that no one knew where that was, that only a few police officers
Yeah.
or knew, but now I think we all know.
It's more open now. I'm
Yeah,
not
I
sure
went to
that's
do
good
a
or bad.
donation to them and they met me in a parking lot,
Did they?
Yeah.
well,
so.
Yeah, I was in Rotary and we actually got to tour that, it was the older,
Right, yeah.
before they did the upgrade.
Well, I think that was good.
Yes, very good.